Hello guys, my name is Anisukatsi. I hope I find you well during this self-quarantine phase. So out of boredom, I decided to record a series of short videos, or maybe rather long. I don't know how they'll turn out to be. This is my first time, so to bear in mind where I'm wrong, you help me. Where I get shy, just understand that shy niggas exist out there. So this one will be on the blood supply of the whole body. Preferably, I'll cut it into two. One arising from the level of the heart, then the other one will start from the heart going down. So I'll start. For now, I'll neglect the veins. Okay, so we start at the base of the left ventricle, where we will have the ascending aorta arising from that part. So the ascending aorta gives rise to two very important branches that are, of course, supplying the heart itself. So that's the left and right coronary artery. The right coronary artery arises from the anterior aortic sinus, and then the left one comes from the posterior. So the right coronary artery will supply, of course, the right ventricle parts of the right atrium. It has the anterior and posterior ventricular branches. It has an arterial branch, of course, which supplies the SA node, and then this SA node may be supplied by a branch from the left one in 35% of the people. Remember, we say the structures on the right. Okay, let's neglect embryology for now. But then we also have the posterior interventricular artery, the branch as well. All right. Then from the left one, I have the anterior interventricular branch, which may give rise to what, to the imaginal artery. Remember, the imaginal artery came from the right side, may arise from the anterior ventricular artery. Then we have the circumflex artery, which is as well a branch of the left coronary artery. Then from this ascending aorta, we then get to the arc of the aorta. Remember, an arc is sort of an arc. It is a convex surface and a what? And a concave surface is the one that is inferior. So from the convex surface, we have three very important branches arising from that part. So we have the left subclavian artery and the left common carotid artery, which we will follow as we go up into the heart and neck. Then we also have the right brachiocephalic trunk, which will, at the level of the right sternoclavicular joint, divide to give rise to a right subclavian and a right common carotid. So we will follow the common carotid. Sorry, let's start with the subclavians. Then we, for the purposes of order, then we come back and follow the common carotids as we go into the region of the heart and neck. So let's start. So remember, the scalenus anterior muscle will have an attachment to the first rib, right? So at the level of that attachment, anterior to that, there's a groove for the subclavian vein. Then posterior, we have the subclavian artery. So this scalenus anterior muscle will, of course, divide our subclavian artery into three parts, and we'll talk of the various branches that arise from these three parts, as well as bearing in mind that a cervical rib may compress the subclavian artery in the space between the scalenus anterior and the scalenus medius muscle. But that's for another day. That is, if I am to cover it at some point. So the first part of the subclavian artery will have three branches. It has three branches. One of these three branches, we have three branches. Easy. So we have the internal thoracic artery. The internal thoracic artery will descend a fingerbreadth lateral to the sternum, in common with the internal thoracic vein. And then I've talked about one. Then the other one is the vertebral artery, which would rather give emphasis on when we talk about the blood supply of the brain. When we talk of the vertebral arteries, the two of them joining to give a basilar artery and that circumflex, but I will just mention a bit of it right now. So it is four parts. It is a cervical part, then it is the part that is within the foramen transversarium of C1 to C6, then it is the part that is in the suboccipital triangle, of course, in that groove on the C1 vertebra, on its posterior arc, then, which is the largest arc of that C1 vertebra. Then we have the cranial part, which gives those common branches that we're all used to. However, we should remember that the cervical part, that is the first part of this vertebral artery, will give rise to spinal branches and other muscular branches within the neck. Then that cranial part will give rise to, of course, isn't we say the left and the right, they unite and they form a common basilar artery that runs on that basilar groove on the pons. That is, they unite at the level at the level of the pontomedullary junction. So it gives rise to anterior spinal arteries and posterior spinal arteries. Then we also have pica, that is the arising from the vertebral arteries, that is posterior inferior cerebellar artery. So in this basilar arteries, sorry, this vertebral arteries will unite to give rise to a basilar artery. This basilar artery will end by giving the posterior cerebral arteries, not cerebellar, cerebral arteries. Then the part that is in the middle of these two terminal branches, of course, will participate in the circle of Willis, which we'll talk about later on. Then further down, we have eye canal, that's the anterior inferior cerebellar arteries. Remember, between these two we have the oculomotor nerve, so it may be suppressed when you have dilatations of these vessels. Then, so I've talked about the vertebral artery, so we're still on the first part of the subclavian artery, having three branches. So I've talked about the vertebral and the internal thoracic artery. So now I want to talk about the thoracocervical trunk. This thoracocervical trunk will also give rise to three branches. We have the inferior thyroid artery. Of importance is the inferior laryngeal vessels. Of course, if we have covered the larynx and the pharynx, we'll remember those. Then, so I've talked about the inferior thyroid artery. Then I have the transverse cervical artery. This transverse cervical artery, of course, will divide into two. It gives a superficial branch and a deep branch. The superficial branch will supply the trapezius muscle. Then the deep branch may be called the dorsoscapular artery, which supplies the levatoscapular artery, or may arise from the third part of the subclavian artery, which some authors will say it doesn't have any direct branches. Then, so from pec minor, sorry, not pec minor as such, but from from the lateral border of scalenus anterior to the lateral border of the first rib, that's the third part of the subclavian artery. Then oh, I've neglected the second part. The second part will give rise to a costocervical trunk. The costocervical trunk will divide into that superior intercostal arteries that supply the first two posterior intercostal spaces. Of course, the lower 9 will be supplied by the descending thoracic aorta, which gives intercostal arteries. Then that 12th one, of course, we have the subcostal artery, which is not an intercostal artery. I guess there's no new information to any of you. Then from the lateral border of the first rib, the subclavian artery will then become the axillary artery. The axillary artery will also be divided into three parts, but it's relatively easy in the sense that the axillary artery will have the first part we have one branch, the second part we have two branches, the third part we have three branches, so it's relatively easy. And then the branches from the second part, they all pierce the clavipectoral fascia and accompany with the cephalic vein and the lateral pectoral nerve, and arguably for some people they consider the medial pectoral nerve as well, but okay, I don't know, I'm not an anatomist, but so the part that extends from the lateral border of the first rib to the medial border of pec minor, that's the first part, giving rise to one branch. It's the first part, one branch, gives rise to the highest thoracic artery. The second part lies deep to the pec minor, gives rise to two branches, the lateral thoracic and the thoracoacromial artery. These arteries will pierce the clavipectoral fascia. They also supply the breast tissue as well with blood. Then the third part will give rise to three arteries as well. Then we also have flapping. Then we also have the third part as the subscapular artery and the two circumflex arteries of the humerus, of course, that wind around the neck of the humerus. That's the anterior and the posterior circumflex arteries. Then from that we have I was talking about the axillary artery. Then it ends at the lower border of teres major becomes the brachial artery. The brachial artery will end at the level of the cubital fossa, giving rise to the more larger branch, that's the ulnar artery, and the smaller branch, that's the radial artery, which arises at the level of the neck of the radius. So this brachial artery that we have just introduced into the picture will give rise to nutrient arteries. We have the profunda artery, which is the artery of the posterior compartment of the brachial artery. Generally, we just consider it as the artery of the anterior compartment of the forearm. Then it may also be considered an artery of the lateral compartment of the forearm, in company with the radial artery, of course, which we have just introduced into the picture. So this brachial artery will also give rise to a superior ulnar collateral artery. The superior ulnar collateral artery, its essence is that it accompanies the ulnar nerve midway down the upper arm, when the ulnar nerve pierces the muscular septum to go and lie in the posterior compartment. The superior ulnar collateral artery will accompany it. Meanwhile, the inferior ulnar collateral artery will emerge a little further down. These two arteries will take part in the anastomosis around the elbow joint. Then the ulnar artery and the radial artery, I will not really dwell much on them, but the ulnar artery, of course, is the artery of the anterior compartment of our forearm. It runs relatively superficial. Then at the level of the flexor retinaculum, this ulnar artery will lie lateral to the pisiform bone and the ulnar nerve. Then the radial artery, of course, you find it its pulsations in that anatomic snuff box. So the ulnar artery will cross the flexor retinaculum anterior, and then of course it will give rise to the superficial palmar arc, which when I have extended my thumb like this, we find it at the distal border of the extended thumb. We know the deep palmar arc arises from that radial artery, but then with the extended palm like this, I will find it at the proximal border of that extended thumb. So due to the time, I'm seeing the time is almost 12 minutes now. I haven't even touched the common carotids and stuff. So I want to go back to the side so it doesn't become long and boring. So we talked about the subclavians going to the limbs, to the upper limbs, I mean. Then this common carotids, right? So the common carotids, we can palpate them by pressing them against the C6 vertebra. That's the first science. I can't pronounce it, but just know that it's C6. Then the level of C3, C4, they change to give you the internal carotid and the external carotid. So I will dwell first on the external carotids. If I fail to talk about the internal carotids, of course I can start with them when I talk about the other one. So the external carotid now, what's an easy way of remembering it? We have two branches that come from the posterior surface, three from the anterior, then the other one from the medial. So from the medial, that's the ascending pharyngeal. From the anterior, I have the superior thyroid. Remember we talked about that inferior thyroid coming from that thyrocervical trunk of the first part. Then I have the lingual, I have the facial. Of importance on the facial, remember that's where we have the tonsillar, the ascending palatine, and the submental arteries. Then I talked about superior thyroid, the lingual, the facial. Then from the posterior surface, I have the occipital artery, where it originates. The hypoglossal nerve hooks around it. Then I have the posterior auricular artery. The posterior auricular artery will give rise to that very important artery, the stylomastoid artery, which accompanies the facial nerve in the stylomastoid foramen. In this foramen, then we have this artery giving rise to branches to this facial nerve and so forth. So of course, then it has terminal branches, a superficial temporal, and a maxillary artery. The superficial temporal is the smaller branch, but get this, it's the more direct continuation of the external carotid artery. Then I have the maxillary artery. The maxillary artery, funny enough, has three parts as well. A part in the pterygopalatine fossa, the inferotemporal fossa, and then we have a mandibular part. The first two parts give rise to branches that accompany the branches of the mandibular nerve. Then the third part gives rise to branches that accompany the maxillary nerve. So just think about branches that arise from the mandibular nerve. When you think about those branches, of course we'll cover that. I'm planning on doing another video after I do the venous blood. I will do one on that. Then so the first part of the maxillary artery gives rise to meningeal branches, the accessory, the medial. What else can I talk about? Then we have the inferior alveolar, the deep tympanic. Let me just see if I can find any of them anywhere where I am. And then anterior tympanic. Then from the third part of importance, I have that posterior superior alveolar artery. Remember, we talk of those posterior superior alveolar nerves from what do you call it? From the maxillary nerve. Then I also have infraorbital, greater palatine, pharyngeal, sphenopalatine, and then the transverse cervical artery will arise from that superficial temporal artery. Then what else can I talk about? Then let's come back to the internal carotid artery. Internal carotid artery has a plexus, a sympathetic plexus that later on gives rise to the deep tympanic, that deep petrosal nerve that joins the greater petrosal nerve. Then you have that deep tympanic plexus and etc, etc. That's something else. Then we will have the of importance there. We have the what do you call it, the ophthalmic artery. Then of course its terminal branches, that the posterior and the anterior and middle cerebral arteries, and we have an anterior choroidal artery. Then we have an anterior communicating artery. Then we have a posterior communicating artery that goes to join those posterior cerebral arteries that we talked about. Wow, that's just something else. Yeah. Then of course they form the sac of Willis and so forth. So the reason why I have not really dwelt on those is it's a bit it would take time for us to dwell on the blood supply of the brain. But of course I've talked about the anterior and the middle. Remember, the middle cerebral arteries will then give rise to those lenticular striate arteries. Those lenticular striate arteries are the true arteries to the what do they call this, what can I say, to the basal ganglia. Yes. Then well, okay, so I think let me just get to 20 minutes. I'm left with 2 minutes 10 seconds, so let's just go back to the level of the heart and descend with that thoracic aorta. That thoracic aorta will then give rise to esophageal artery, bronchial arteries, those lower 9 posterior intercostal arteries that I talked about when we did talk about the upper 2 coming from that superficial intercostal branch that came from that costal cervical branch of the second part of the subclavian artery. So at the level of T12, the thoracic aorta will pierce the diaphragm to become the esophageal aorta. So the relation here is very simple. Add more to the left, the thoracic aorta; in the middle, the thoracic duct; then more to the right, we have the we have the acerca system of veins, arising of course from right right lumbar and whatsoever. Then right lumbar and right subcostal veins. You may think I don't know, but should we go down? Oh, the internal thoracic artery will, at the level of the 6th intercostal space, split into 2. We have that musculophrenic artery, musculophrenic, self-explanatory. Then it gives rise as well to the superior epigastric artery. Remember, the inferior epigastric artery comes from lower down, and it gives rise to that cremasteric artery that supplies the cremaster muscle. Okay, so when I start the next time, we start at that T12 part when we talk of the celiac trunk. Then we go down and talk about the superior mesenteric, mesenteric vessels as well. Then of course, probably they say maybe from the thoracic or from the lumbar region with that great artery of Adam's quits that supplies, which is an accessory artery to the spinal cord. Of course, we did speak of the anterior and posterior spinal arteries arising from that vertebral arteries. The posterior may be arising as well from Pika or whatever, but with that great artery of Adam, which is very important, and which is the largest accessory artery that arises from that part. So I've clocked 20 minutes. I'll restart on the level of T12.